My name is Julie Rowan Zock. I had the experience to live in Germany and experience what it's like to have health care. So what we would otherwise call socialized medicine, because it's the government regulates the fact that everybody has health care. So whether you pay through your employment and you're paying a fee to a private insurer, but the private insurer is so well regulated that I'm paying according to how I earn and not according to their will, and the government regulates that. So, yeah. I could go to any doctor I wanted, and that includes dentists. I'd never had to go for eye care. Actually, I did, because I have floaters. So I did have an eye doctor look at that, and all without having to pay anything extra. There is no copay at the time. I'm not sure how it is now. This was in the late 80s, all through the 90s, and had brought my 2 children into the world in Germany and had an operation on my knee in Germany. So I do appreciate the fact that I never had to worry about either their health or mine and my finances either, because everything was covered. And what was great about having given birth there was was the care throughout, the care in the hospital. I had to unfortunately stay longer through complications for both births, and not a penny extra was asked of me. Actually, I was the one pushing to go home early just because I was tired of sitting in a hospital bed. But the doctors want to make sure that you're in good shape before they send you home. So, and with neither them nor myself worrying about how that was going to get paid for. Yeah. No anxiety, no loss of sleep, never ever fearing that you're going to go bankrupt or have huge costs that are going to affect your family life. I consider myself extremely fortunate. In the last 19 years living in the United States, the only reason I had to go to the doctor was for a case of strep throat. And although that didn't cost me extra, I did have to pay a little bit for the pharmaceuticals, but I have not had to go to the doctor. So the only other reasons I've had to go are for checkups. So knock on wood, it stays that way for a while. But that's one of the reasons why I'm also pushing for Medicare for all, because I want that to change not only for myself, but for my children. At this point, I am not advising my daughter, who is studying in Germany, to come back. Because it's not, especially for a young woman in childbearing years, it is not advisable, if you have the choice, to have your children elsewhere where it's not going to cost you anything, especially since the rate of complications in birth is rising in the United States. So, absolutely.